Now, I want to turn to the pandemic. On Thursday, President Biden announced incentives and requirements to get more Americans vaccinated.
We've made it our first and top priority to have available vaccines for every eligible American, and that's never going to change as long as I'm here. And it's a shame. It's just such a shame to squander that blessing.
His remarks came after the CDC recommended that vaccinated Americans mask up again in areas with substantial or high infection rates. According to the CDC, nearly two-thirds of the counties in America fall under that category, and many of those places are in the South. Yet partisan political battles remain at the center of this pandemic. House Minority Leader Kevin McCarthy said in a tweet that the mass changes at the Capitol were not based on science. And he said, quote, liberal government officials want to continue to live in a perpetual pandemic state. In response, Speaker Nancy Pelosi had sharp words for McCarthy.
To say that wearing a mask is not based on science, I think, is not wise. The Republican Party has been delinquent in embracing the science that people need to be vaccinated.
Joining us now is Dan Diamond, national health reporter for the Washington Post. Thank you so much for being here, Dan. Now, an internal CDC document revealed this week said that the Delta variant appears to cause more severe illness, to be as contagious as the chickenpox, and is more likely to cause breakthrough infections. All of those things scare me. What more do we know about the science behind the changes we saw this week and the possible danger ahead? We're having a bit of a challenge with audio, so I'm going to go to Kelly, and we'll come back to you, Dan. I'll come to you, Kelly. The White House is obviously they're struggling with this, and they didn't want to be here. Just in this month, we had President Biden celebrating normalcy. What are you hearing from the White House and the way that they're doing?
The big difference for the Biden White House is they came in with a mission to try to get vaccines out the door and into arms. And now this is really the first time they're grappling with a dynamic change in the virus itself, a new level of danger, a new level of threat. As the president left the White House on Friday evening going to Camp David, he was asked, should Americans expect more restrictions and guidelines? He said, in all probability.
And Dan, I hear that you're back. It's 2021, so of course that would happen. So Dan, I'll lead into you again. Tell us about the science, the danger ahead.
Well, I don't know if I can critique the CDC on messaging challenges if I'm having my own, but the CDC found, Yamiche, out of Massachusetts, as my Post colleagues first reported, was that the Delta variant is really challenging what we knew about the protection from vaccines. The vaccines still remain overall very protective. But in a study of several hundred infections in Provincetown, it appeared first that vaccinated people were getting infected and spreading the virus to others. And second, that the Delta variant itself is moving more quickly than previous versions of the virus. If you're even looking across the country, the number of cases has gone surging up at the beginning of the month, around 12,000, 13,000 per day. The Post average now is 75,000 per day. So the CDC looked at that guidance and made a very difficult call. About 2 months ago, the agency had said, if you are vaccinated, you don't need to wear a mask in most places. Now they're saying in most of those counties across the United States where transmission is relatively high, masking remains a significant tactic before everyone gets vaccinated to make sure that people who are vaccinated or are not vaccinated, they're both not spreading the virus.
And Dan, I want to stick with you. You talk to health officials in states who are literally begging people to be vaccinated. I wonder, how much do you think people can be persuaded? What happens if we can't persuade more people? And then long term, I'm also wondering, can you talk a bit about vaccine mandates? And if people can't be persuaded, might vaccine mandates be the way to do this if you're hearing from experts?
So, Yamiche, I did speak with the California Health Secretary earlier this week, who said we were in a phase of getting down on our knees, asking people to take the shot. That has really slowed down. Overall, about 60% of American adults are fully vaccinated. The rate has very slowly crept up. So these incentives, be them vaccine lotteries, asking nicely, it just doesn't seem to work, given that so many holdouts have been just set in their ways, set in their beliefs for a variety of reasons, whether they're not sure about the science of the vaccine, which I should say has been proven to be effective overall. And even in this new study, CDC found if you have a vaccine, significantly protective against the new Delta variant. But the number of Americans in states who are holding out, that has led California to require all health workers, all state workers to get vaccinated or prove that they're not testing positive for COVID. We've seen President Biden echo that on a national level. They don't want to call it a mandate at the White House. Mandate is kind of a dirty word in politics. For anyone who remembers the Affordable Care Act, they're calling it a directive. But same idea that you are going to have some pressures put on you to get vaccinated. And if you're not vaccinated, there will be restrictions based on what you can do at work.
I want to come to you, Rachel, because Dan said something. One, you're asking nicely doesn't seem to be working.
Yeah.
But two, a mandate is seen as a sort of bad word when you think about the White House's strategy here. What are you hearing about how much politics and political backlash really is factoring into how the White House thinks about this? I should tell you, sources tell me, of course, we're not thinking about politics, but obviously it's a thing.
Yeah, the White House, they insist that this is not political, right? The virus does not discriminate. But what we do know from looking at polling data also is that vaccinations are along party lines, and you have Republicans in this country that are less likely to get vaccinated. And the White House continues to say that people listen most to the leaders in their own communities, right? And so when you have some Republican leaders, not all, but some Republican leaders that are pushing messages saying that these masks don't really matter, do not wear them, they're mocking some of the CDC guidances in states like Florida. You heard it straight from the governor even this week. That is going to be a challenge for this administration, and a significant one for President Biden. I think he knows that overall the success of his administration is going to depend in large part the way that the American public views how he is handling this, the response to this virus. And that's a big reason why he called out Senate Minority Leader Mitch McConnell this week, praising him for encouraging Americans to get vaccinated.
We only have about 45 seconds left, but I want to come to Kelly, and you know how to wrap something in 45 seconds. Infrastructure happened, but will this deal actually hold up? Will it happen?
The fact that we are as far as we are with a bipartisan agreement is worthy of praise for those involved. That is a big statement. Now, getting it across the finish line, I think we're going to be talking about infrastructure many more times in the weeks ahead, because it will be complicated and difficult. But there is such a desire on the part of both Republicans and Democrats to get something done that I think that will is at the moment has the momentum.
And I have only about maybe 10 to 15 seconds, but Ryan, I want to pull you in really quickly, which is what connects these two things that we were talking about tonight is the fact that there's a conspiracy and the threat still exists. What do you make of that?
Yeah, I mean, you can see those ties, right, between the Capitol attack and, the pandemic as just like there's a lot of political leanings that are not believing what the government is saying here and don't trust in the government. And that's a real problem, I think, for democracy going forward and for the nation's health.